Hello, my name is Kim Hendry, Program Manager for the Child Neurology Foundation. Today, I'm going to introduce to you the Neurology Social Services Network, or NSSN, which was launched by the Child Neurology Foundation in 2022. First, I'm going to describe the network and talk a little bit about how CNF came to the decision to launch the program. Then I will discuss our vision for the network and give a preview of how we use Unite Us to connect families with services. First, what is the Neurology Social Services Network? The NSSN is a group of more than 40 community-based organizations in the neurology community that have come together to provide support and wraparound services in a coordinated and organized way. These organizations want to provide resources for families and want to be able to collaborate with other organizations to make sure that our families get the support they need. Over the years, CNF has heard from organizations that it is challenging to find resources for families in local communities, especially when serving families nationally. Here at CNF, we would Google resources for families, give a warm handoff via phone or email, and hope that our families were taken care of. But we never really knew the outcome of the care they received. So we decided to look for a web-based platform that could help us support families both locally and nationally in a variety of social service areas. We vetted many platforms and finally found one that could support us in this endeavor. This platform is called Unite Us. Unite Us is an online social services platform that connects families to a variety of social services through a closed-loop referral system. A major reason for why we chose Unite Us is because of the extensive number of social service organizations in the platform, the ability to keep all information confidential for our families, and the ability to aggregate de-identified data on the back end. When I talk about the closed loop referral system, I mean that your organization will be notified via email every time an action is taken on behalf of your family. Confidentiality is also very important. I will never be able to see the personal information of your families, and you will not be able to see the information of my families. Finally, we wanted to be able to collect de-identified data about the types of social services our families in the neurology community were needing and getting and needing but not getting. Long-term, we want to be able to advocate on behalf of our families at the local and national level to help our families get the support they need. CNF wants to gather as many organizations in the neurology community to be a part of this network so that we can have a diverse representation of the social services our community needs, and so we can reach as many families as possible. We have found that our families don't just need medical doctors. Because healthcare is expensive and because there are so many costs associated with having a medically complex child, families are needing so much more. They are needing help with food, housing, employment, respite care, and financial assistance. Unite Us and the NSSN helps us connect our families to these supports. There is no cost to you to be a part of the network. CNF has paid for the cost of aggregating the de-identified data on the back end. It is completely free for any 501c3 to be a part of the Unite Us platform. There are some major benefits of being a part of the NSSN. First is collaboration with the neurology community. We have found that being a part of the NSSN allows us to identify the programs that other organizations offer and then take advantage of those programs. We have a slide deck of all of the partners and the programs they offer that goes out to all the organizations in the NSSN. We also host quarterly collaborations where we share out the de-identified data from the entire neurology community. You will also have access to your own organization's data so you can see which social services your families are most in need of. If you decide to partner with us, there is a contract. The contract just gives us permission to aggregate the de-identified data on the back end and also holds us accountable to the quarterly collaboration meetings where we share out that data. I would be happy to send you a draft of the contract for you to preview as well. Our vision for the network is to expand so that we can help as many families as possible in a variety of disease states. We will continue to host quarterly conversations and collaborations until the end of 2024. We are currently advertising to hospitals and clinics to make them aware of the network and the services and programs we provide. Currently, Unite Us is in the states that are in blue on this map. This is where we will be aggregating the de-identified data. Now I would like to give a brief overview of how Unite Us works. We would be happy to set up a time to give you a demo of the actual platform and allow you to ask any questions you have if you would like to be a member of the NSSN. First, a family will go to your Contact Us page on your website. You will work with Unitas to customize this form on your website and tailor the information that you would like to receive from your family. Once the family fills out this assistance request form, you will get an email notifying you that there is a request. You will log into Unitas, view the information provided by the family, and then browse a map to find the social service organization that meets your family's needs. You can also fulfill the request through your own organization if you provide the service they are looking for. When you browse the map, in Unitas, you will locate the social service your family is looking for in their local area. If there's nothing in their local area, you can also find a national organization that can provide the service. This is common for services such as financial assistance. Once you have submitted the referral to that organization, the organization will get an email notifying them that they have a request. The organization can accept the request, hold the request to get more information from the family, or deny the request if they are unable to fulfill it. You will get an email notifying you of the status they chose. If they are able to help the family, they will then help that family and close the case when completed, and you will get an email notifying you of that outcome. This is the closed loop referral system that we referred to earlier. Next, if you are a visual person, here's a diagram explaining the process. You can see here that the NSSN organizations are part of the Unitas platform, just like thousands of other social service organizations. At the Child Neurology Foundation, we would receive a request through our assistance request form. We can also receive requests via phone or email and enter the client into the Unitas platform after they have given us consent to do so. Then, based on their needs, we can refer them to your organization if you can support them, help them in our organization if we have a program to assist, or refer them to another social service organization if they need a service such as respite care, financial assistance, a food shelf, and so on. As described earlier, you will be able to track the status of any referrals you make. If you choose to accept the referral, you can take notes in the platform to track communication and progress. If you would like to learn more about the NSSN or be a part of the NSSN, you can reach out to me at programs@childneurologyfoundation.org. Thank you and have a wonderful day.